Station. Right. So if you've read and understood, considering its surgical anatomy station, please tell me which region are you looking at?
In the shoulder region, ma'am.
Okay. And in the shoulder region from the front, you're looking at certain structures which are labeled from A to F. Would you be
Yeah.
able to identify what type of structures are these?
It's the brachial plexus, ma'am.
Okay.
Here is the root, trunk, and division.
Okay. Please demonstrate exactly
Yep.
the surface anatomy of the brachial plexus on a living person.
Sorry, ma'am.
Can you demonstrate or tell me the
Yes, yes,
surface anatomy of the
yes,
brachial
yes, ma'am.
plexus? Yes,
Yes.
yes.
Roots in the neck between the scalenus anterior and medius muscle. Root, trunk, then trunk behind, at the level of third part of the subscapular artery. Division behind the middle third of the clavicle, and root in relation to the second part of the axillary artery.
Okay. So it's shoulder, arm, and forearm. Okay. Please, right. Can you please tell me what are the dermatomes? These what are
Yeah.
the dermatomes? These brachial plexus on a patient
Cervical
involved?
5, 6, 7, 8, and T1.
Okay, this is the normal one. What are the
Yeah.
variations that you can
Sometimes it
confirm?
involves the cervical 4 and the
Yes.
thoracic 2
All right. Okay. Then it is called prefixed and
and
postfixed.
postfix, right?
Right. Okay. You told me the parts of the brachial plexus, like its roots, trunks, divisions, cords, and the branches. Please tell me how many branches there are from roots.
Okay. It's two branches, the long thoracic nerve and the dorsal scapular nerve.
Where exactly these roots are found?
Root in between the scalenus anterior and medius.
Yes. And the exit
And then
from which foramina?
uh, intervertebral foramina.
Yes, in between these two muscles, right?
Yeah.
What about the trunks? Where would you find them?
Trunk in the posterior triangle in the behind at the level of the third part of the subclavian artery.
Yes. Okay, how many branches can you find from the trunks?
Branch root trunk.
No branches from the trunks.
No
Okay.
branch. Yes, no branch.
Okay. Where exactly would you find divisions?
Division behind the middle third of the clavicle.
All right. And the cords?
What's in relation to the second part of the axillary artery?
Axillary artery. Please tell me, all right, what are the final branches of the cords? Medial, lateral, and the posterior cords?
Yeah.
Yes.
From medial lateral cord, we get the medial pectoral nerve, medial root of the median nerve, and musculocutaneous nerve. And
Okay.
from the posterior cord, we got the radial nerve, axillary nerve, upper and lower subscapular nerve, and thoracodorsal nerve. And from the medial cord, medial root of the median nerve, medial pectoral nerve, medial cutaneous nerve of the arm, and medial cutaneous nerve of the forearm.
Okay, good. Please tell me, in the stem, you have read a scenario. What is your provisional diagnosis of this scenario?
Okay, it's the Erb's palsy.
Erb's palsy. Please tell me the findings on a patient that you suspect has suffered or the Erb's paralysis?
Okay. In the arm, he cannot. Arm will be the adducted and medially rotated. In forearm is extended and pronated,
Okay.
and the sensory, the loss of sensation in the lower half of the deltoid region.
Okay, so in what sense would you say that this will be damage of which nerve roots?
Cervical 5 and 6.
All right, okay. Right. And the forearm will be in extension and pronation.
Yes,
And it's also called waiter tip deformity.
water tip deformity.
Right, okay. What can happen, or you can tell me how would a patient present to you when he or she will have lower trunk injury?
Yes, in patient with lower trunk injury, there will be the claw-like hand,
Okay.
the Horner syndrome, and loss of sensation in the medial sides of the forearm and the hand.
And what is the condition called?
The Klump's paralysis.
Paralysis. Okay. And right, please tell me what would be the sensory loss in case of Klumpig's paralysis?
Loss of sensation in the medial sides of the forearm and the hand.
Yes, yes, medial side of the. And
Yeah.
what motor involvement would be there?
Yes, loss of intrinsic muscle of the hands
Right. And okay.
and lumbricalis.
Yes, and paralysis of the wrist flexors,
Uh,
and there'll be
Yes,
hyperextension of the metacarpophalangeal joint
metacarpophalangeal
and
joint and
flexion
the
of.
interphalangeal joint.
Right, very good. Okay. What kind of management can one suggest to the patients who are suffered Erb's paralysis or Klumpig's paralysis?
The physiotherapy,
Yes.
uh, then if it's not improved, then we go through the surgical management.
Okay. You could maybe also advise pain management
Yes, pain
and other,
management.
yes, according to the need. Right. If we can try and identify these structures from A, it's a muscle, as you could see. What could that be?
The muscle,
Bicep brachii.
biceps brachii.
Right. If you could identify this structure here, B.
B is the median nerve.
Very good. If you could identify number C.
C is the ulnar nerve. Ma'am, it's sometimes difficult for me to
Yes,
watching.
I know. I am sorry, but it's not me. If you could identify F.
Yes, F posterior quad.
Okay. E.
Dorsal scapular nerve. D is dorsal scapular nerve.
Okay.
E is suprascapular.
Okay. Right. Thank you. Thank you.
Thank you, ma'am.
Thank